wanted to get out of pain. I wanted a quality of life that I wasn't having.
Glenn first came to my clinic with excruciating bilateral hip pain. He had lost his independence, his mobility, and was virtually unable to walk.
We were in the hospital every 2 weeks, just about, with urosepsis. It took a lot of years off her. It affected her memory and just a lot of how she functioned.
I met Stella back in early 2022. She has chronic issues with urinary obstruction due to stones and things like that. She was very frail, had limited mobility, really required a lot of support from her family.
Do I want to live this way the rest of my life, or do I want to do something about it?
The Geriatric Surgery Verification Program helps us personalize the patient's care for them.
We start by putting them through risk screening, and then we identify the unique factors for that patient that we need to focus on in addition to their traditional surgical care.
Every week, I help facilitate a multidisciplinary team meeting, which is where our team members come together from various disciplines to talk about our high-risk patients and make recommendations specific to those patients' needs.
We ask the patient, what are your goals of care? Is your goals of care to be able to just walk? We're able to create a personalized plan for this patient.
I went in and I had my left hip put in. Everyone was pushing you and seeing that your welfare was the most important thing.
When I came and saw the surgeon here, I feel like it was night and day. The nurse practitioner will call me and make sure that I'm on board with her care and what their plan is.
We're spending upwards of $185 billion a year to treat postoperative delirium.
Delirium is a big complication that is very hard to treat, but more easily avoided.
The benefit financially is actually tremendous. If we can prevent costs associated with postoperative delirium, then we're looking at orders of magnitude of tens of thousands of dollars saved on cost of care per patient. So we have geriatric-specific friendly rooms that are designed around the needs of a geriatric patient.
Being able to see a clock when you wake up from surgery really helps maintain your orientation. You know what time it is, what day it is, or having big whiteboards with who your doctor is, when your next pain medication. It helps keep the patient present in the moment.
We have seen that implementing GSV standards in our hospitals leads to those hospitals outperforming hospitals that do not have those standards.
Since the GSV program came in, I can honestly, truly say that I feel more safe.
GSV pushes us to be patient-centric rather than problem-focused.
You know that everybody is aware and focused on this person and making sure that she's going to have the best outcome. And to me, that's comforting.
I would just like to take that opportunity to thank the doctors and the staff. It was great.